The reason I decided to join the healthcare field and become a respiratory therapist, in my senior year of high school, my grandmother came down with lung cancer. And that was very difficult for us, and it was sudden onset, and there's really nothing you can do about that. And it really helps to kind of learn about that stuff. And over the course of the past 18 months, is really helped to learn about the disease processes and all sorts of lung diseases that you may encounter in the world, and it's been really, really interesting and helpful to me.
When I started, there wasn't necessarily any particular reason, but my grandfather was in the Vietnam War and did have COPD, and the Agent Orange affected his lungs and heart and stuff. So originally there wasn't, but after I had joined the program and learned and made a lot of connections between my grandfather and stuff, and I did kind of have a moment of realization of how much it does benefit the people in our area.
I always wanted to do nursing, but so many people told me that it's just the same thing every day. You do the same, like, over and over and over, repetitive work. But my aunt's actually a respiratory therapist at Poplar Medical Center, and she's the one that actually got me into respiratory. So I had done more research on that, and I thought that would benefit me more than nursing, and it sounded more interesting because you do a lot of stuff. You deal with vents, BiPAP, breathing treatments, just different stuff, and you're all over the hospital, so that's why I like going to get into it.
My name is Wendy Wight, and I am the Program Director here at Southeast Kentucky Community and Technical College for the Respiratory Therapy Program. We do different areas of education for our students in order to try to help them be very efficient and very well educated upon graduation. We have lots of lab time for them that we bring them in, and we let them have hands-on education to where they can actually apply that to the things that we are learning didactically in the classroom.
Eastern Kentucky, or more specifically Letcher County, would be almost kind of lost without Southeast. Absolutely provided not only jobs, but educations and community experiences for everyone.
I feel like that without Southeast, that we would have fewer healthcare workers, fewer respiratory therapists, fewer nursing, everybody, because I feel like that we understand our people, and I feel like that we actually take care of our people in this region. And so I feel like that if we didn't have Southeast producing these types of healthcare students, that we would be very, very, that would be detrimental to our population and to our area. Our students, we give them a quality education in about 18 months. And so we have those students, we want to make sure that we get our students out into the field working at a faster rate.
I do believe it's helping. I mean, in our Appalachian region, there's so many patients. Like I said already, the COPD, smoking. The smoking can lead to COPD. We got the coal mining industry was really popular. So we got our black lung patients, and we even have white lung patients from gravel.
I would like to stay in the area because it's closer to my family and friends, the people I've grew up with and been around my whole life, but being from a small area, you don't travel as much, so having a career that could take me outside of my state and experience more is always something that I've been interested in. I think Southeast plays a really big role in the success of Eastern Kentucky, especially in our area, because of the education you're able to provide at like such a small cost. You know, people are not as financially stable, so their income is lower, and they're able to qualify for more financial aid. I'd be back quite often, to see my family and things, and maybe even to live at some point. Like they say, once you're born here, your heart's always in Kentucky.
Our graduates will work in different areas of the hospital. They will work in ICU, they will work the surgical floor, they will work the medical floor, they will work in the cardiac units, doing various different procedures and interventions for those patients. And it can be anything simply from just doing oxygen therapy, from doing incentive spirometry, to doing airway clearance, to doing management of mechanical ventilation or life support.
I don't think if we could do it without Wendy and Delilah, Wendy's a really great professor. She knows her stuff, and anybody would be lucky to have her as a professor.
Wendy and Delilah are great. I think the program would never make it if we didn't have them. They really don't get the credit they deserve in terms of how much work they put in. Really keep this program going and make sure, there's a consistent flow of new respiratory therapists in our area.
So they have a very broad knowledge, and within the region they have a lot of different avenues that they can help patients that have the COPD diagnosis. So our respiratory therapists are very vital for this area, in that our instances of respiratory disease and lung disease is higher, and so these students are going out as graduates and they are making a difference in the community.
We are Southeast.
We are your local community and technical college, nestled in the mountains and valleys of southeastern Kentucky. We are committed to training mountain people for the workforce. We are committed to helping you continue your educational journey, no matter where you are in life. We are leaders, researchers, and committed to our communities. We are Southeast Kentucky Community and Technical College.
I am Southeast.
We are Southeast.
Thank you for investing in me.